Have you been struggling with stubborn weight gain, fatigue, or constant sugar cravings? These might be signs of insulin resistance, a condition that affects millions worldwide and is a precursor to type 2 diabetes. But here's the good news. Insulin resistance can often be reversed with the right lifestyle changes. In today's video, we'll explore what insulin resistance is, what causes it, and how you can take practical steps to reverse it naturally and effectively. What is insulin resistance? Let's start with the basics. Insulin resistance occurs when your body's cells stop responding properly to insulin, hormone produced by the pancreas. Insulin's primary job is to help glucose, or sugar, move from your bloodstream into your cells, where it's used for energy. When your cells become resistant to insulin, your pancreas compensates by producing more insulin. Over time, this leads to high insulin levels, or hyperinsulinemia, and eventually high blood sugar levels. Left unchecked, this condition can lead to type 2 diabetes, heart disease, and other metabolic disorders. Causes and risk factors of insulin resistance. To effectively reverse insulin resistance, it's important to understand what causes it. Here are the main culprits. Poor dietary intake of refined carbohydrates and sugar spikes insulin levels repeatedly, contributing to resistance. Diets high in unhealthy fats, like trans fats, also play a role. Sedentary lifestyle. Physical inactivity reduces your body's ability to use glucose effectively, increasing insulin resistance. Excess weight. Excess fat, particularly around the abdomen, increases inflammation and disrupts insulin signaling. Chronic stress. Elevated cortisol levels from stress can worsen insulin resistance. Sleep deprivation. Poor sleep negatively affects insulin sensitivity. Genetics and age. While lifestyle is key, some people are genetically predisposed to insulin resistance, and the risk increases with age. Symptoms of insulin resistance. How do you know if you have insulin resistance? Common signs include increased hunger and sugar cravings, fatigue, particularly after meals, weight gain, especially around the abdomen, darkened patches of skin, often on the neck or armpits, a condition called acanthosis nigricans, difficulty losing weight despite diet and exercise. If you suspect insulin resistance, consult your doctor for tests such as fasting insulin, glucose tolerance tests, or homeostatic model assessment of insulin resistance. How to reverse insulin resistance naturally. Now that we've covered the basics, let's dive into actionable steps to reverse insulin resistance. Step 1. Optimize your diet. Your diet is the cornerstone of reversing insulin resistance. Here's how to make it work for you. Reduce refined carbs and sugars. Cut back on processed foods, sugary drinks, and desserts. Instead, focus on complex carbs like whole grains, quinoa, and legumes. Increase healthy fats. Incorporate sources of healthy fats, such as avocados, nuts, seeds, olive oil, and fatty fish like salmon. Prioritize protein. Protein helps stabilize blood sugar levels and keeps you feeling full. Include lean meats, eggs, tofu, and Greek yogurt in your meals. Load up on fiber. High fiber foods like vegetables, fruits, and whole grains slow digestion and reduce blood sugar spikes. Time your meals with intermittent fasting. Consider intermittent fasting, such as the 16-8 method, to allow your insulin levels to reset between meals. Step 2. Stay active. Regular exercise is one of the most effective ways to improve insulin sensitivity. Aim for aerobic exercise. Activities like walking, running, cycling, or swimming can help reduce insulin resistance. Strength training. Building muscle through weightlifting or resistance exercises increases glucose uptake by your muscles. Daily movement. Incorporate movement throughout your day by taking short walks, stretching, or standing periodically. If you have a desk job. Step 3. Manage stress. Chronic stress raises cortisol levels, which can interfere with insulin function. To manage stress, practice mindfulness or meditation. Try deep breathing exercises. Engage in hobbies or activities that bring you joy. Ensure a healthy work-life balance. Step 4. Improve your sleep quality. Sleep plays a vital role in reversing insulin resistance. Tips for better sleep include Stick to a consistent sleep schedule. Create a bedtime routine to wind down. Avoid screens and blue light before bed. Make your sleeping environment comfortable and dark. Step 5. Consider supplements. Certain supplements may help improve insulin sensitivity, but consult a healthcare provider before adding these to your routine. Popular options include magnesium, helps regulate blood sugar levels. Omega-3 fatty acids, found in fish oil. They reduce inflammation and improve insulin sensitivity. Berberine, a natural compound that's shown to improve blood sugar regulation. Vitamin D, low levels are linked to increased insulin resistance. Cinnamon may help lower blood sugar and improve insulin sensitivity. Step 6. Lose weight gradually. Even a 5 to 10% reduction in body weight can significantly improve insulin sensitivity. Focus on sustainable changes rather than crash diets, and celebrate small milestones along the way. Step 7. Stay hydrated. Drinking enough water is essential for maintaining healthy blood sugar levels. Replace sugary beverages with water, herbal teas, or sparkling water for added hydration. Insulin resistance doesn't have to define your life. By making small but consistent changes to your diet, activity levels, and daily habits, you can reverse insulin resistance and regain control of your health.